And welcome back to the WHHI Daily News. We have Willie P. Aiken with us once again. I think it's your second visit on our newscast. This time to talk about a prevention awareness program. As you know, he is the coroner of Jasper County. I didn't interview you before, but it's nice to meet you.
Nice to meet you too, Ms. Rob.
Yes, and there's a lot to talk about in really what you do as a coroner. And we were just saying that you see a lot of statistics in the office and trends that are happening. You were saying that we've had a lot of car accidents this year so far.
Yes, you know, the numbers, we kind of try to watch the numbers and compare them to the previous years. Most of the accidents this year, like I said, we haven't had a lot, but the few we did, it involved with alcohol. So, you know, that's just one of the things with our program that we started, the PAP program, that we're trying to kind of bring awareness to the whole community about.
All right, so you've been in office for 3 years, and this has been kind of your heart.
Yes. Your
heart, you do own a funeral home in Jasper County, but your heart is prevention. You see the death, but there's so many things that can be prevented. So tell me where you are with the PAP program.
Okay, well, the PAP program is the prevention awareness program, and what we do with that program is we try to focus in on the community, bring them aware of certain things. Like you said, we look at the statistics of what's going on when it comes to death, you know, as far as heart attacks, strokes, you know, hypertension, things like that. So the program, it started off with bringing awareness to the opioid and the fentanyl fatalities. And then, you know, we said death is everyday thing. You know, there's so many ways you can die. So we kind of try to put things together towards the trending deaths at the time, whether it's ATV accidents or maybe automobile accidents, you know, simple things that we may say, heart disease.
Right, know your body, know those signs and symptoms.
Yes, ma'am, yes, ma'am. So we're trying to get either doctors, nurses to come in with these group sessions that we have.
Well, that's what I was asking. So you have group sessions, so you have speakers?
Yes, ma'am.
So how, is it every week or?
It's once a month right now. We had our first session earlier this year, last month, and we have another session tomorrow. And I believe that's going to be about the drug crisis as well, overdoses. But we're actually working on some different types of meetings as well. That's not just drug-based, but health-based, mental, your mental health. Yes, ma'am.
Right,
yes,
because of suicides, which you've also seen.
Yes, ma'am.
Right.
We work with those suicides, and just to deliver those families the news of that, you know, that's one of those stigmas or taboos that folks don't like to talk about, but it's here, it's real, and you know, just because we don't talk about it doesn't make it, you know, less real.
And when you have your gatherings, are you going after adults, children, teens, or all of the above?
We're going after anyone that's affected by it, anyone that wants to help prevent it. So it can be overdose survivors. We have overdose survivors that attend our meetings. We have parents of folks that passed away during the pandemic, epidemic, things like that. So we invite the community, anyone that's concerned.
So Willie, for the viewers that might not know exactly what the duties of a coroner are, just, you know, very briefly, we have about 50 seconds left. What are the duties of the coroner?
We pronounce the deaths in our counties, whether it's accident, natural, suicide, undetermined. We issue all cremation permits. We do death notifications to let the next of kin. I mean, the list goes on and on.
You wouldn't think that it's that.
A lot of people don't. You know, the coroner's office is one of those positions folks don't like to talk about until the time. But, you know, we have folks that die 3 o'clock in the morning, and then their loved one, they want to come 4, 5 o'clock in the morning to identify them. And then again at 7 o'clock, they want to come again, or they're calling us. So, I mean, it's a 24/7 non-stop job.
And it's a people business.
It is.
I can tell that you're a people person, that you really, you've got to care about people's feelings and a lot of emotions and all of that.
And we want to be proactive versus reactive.
Yeah,
if we
like
can get out there and to the community before our services are needed, I think that's the best thing.
Proactive.
Yes,
right. Thank you.
Thank you.
Willie P. Aiken once again, and we'll see you next time on the Daily News.
Thank you so much.
And there's much more to come, so don't go away.